So some degree of palpitations are going to be normal. Now, I always tell all our patients, so if I put a Holter on anyone, they will definitely have what we call some PVCs, PSCs. But that doesn't mean that they're not abnormal too. So they're abnormal. The danger signs usually are if people are getting dizzy, if they're getting recurrent symptoms, if they're getting increasing symptoms, if they're having chest pain or they're having shortness of breath, if they're passing out, if they're falling with them. Those are usually danger signs. And again, if you had one palpitation here and there, you're likely okay. But if you're having recurrent symptoms which are increasing and any of these danger signs, then there's something going on. And again, to diagnose them, sometimes we do a Holter monitor, event monitor, loop recorders, all different diagnostic modalities available to us that we pick depending on the patient's symptoms, risk factors, and how frequent or severe their symptoms are. Some people might need to come in. Other people might be okay, just outpatient, diagnosing it slowly. So that again is decided on an individual basis. So if there's concern, talk to someone, talk to your doctor, talk to your cardiologist. Hey, I'm having these symptoms. What do you think? And then kind of make a decision, informed decision about that.
Perfect. Okay. Next question. Is there a connection between sleep apnea and heart disease?
Sleep apnea and heart disease is an extremely important topic. Untreated sleep apnea can cause uncontrolled hypertension, increased propensity to stroke, increased incidence of arrhythmias, heart rate slowing down, heart rate going into abnormal rhythms. So all these things can be contributors to sleep apnea. Now, sleep apnea, who could have sleep apnea? Somebody snores, they're tired during the day, they're having difficulty falling asleep and then getting up frequently at night. Those could all be signs of untreated sleep apnea. And the earlier you diagnose it and the earlier you treat it, the better, first of all, the better you will feel, the better you will do. Your need of high blood pressure medications might be lower. Your chances of a stroke would be decreased. Your chances of abnormal heart rhythms would simply go down. So it's extremely important, and it can be diagnosed by a simple sleep study. And what you need is basically treatment of sleep apnea after that, if diagnosed with sleep apnea. And depending on the degree, there are degrees of sleep apnea. If it is very mild, people might not treat it. If it is obviously moderate or severe, then people need treatment for that.